This is the model of ankle joint, and we will discuss about the deltoid ligament. This is the ankle joint or talocrural joint. This is the tibia. This is of left side, and here is the medial side, and this is lateral, and this is the left leg, and this is tibia, this is fibula, this is medial malleolus, this is lateral malleolus, this one is talus, here this one is the talus, okay, and below here this one is the calcaneum. This is the on the medial surface of the calcaneum there is a self-life projection, sustentacular tali. This is navicular bone. This is medial, intermediate, and the lateral cuneiform, and this one is cuboid. Okay, this is talus, and this is calcaneum. Okay, now we will discuss about the deltoid ligament. Deltoid ligament or medial ankle ligament or medial talocrural ligament, because it lies on the medial side. It has got superficial component and the deep component. The name deltoid, that means where the three rivers unite, that point is called delta, and from that this word deltoid is deltoid has come in same as that of the deltoid muscle, where the three fiber, the anterior fiber, middle fiber, and the posterior fiber meet over the deltoid tuberosity of the humerus. Here also there is anteriorly and the middle and the posteriorly in this green color. They are all unite of the medial malleolus, so creates a stigma of delta. That's why called deltoid ligament. Here the superficial is shown by the this light green color, this three, and the dark one, the deep fiber, the deep component is shown by this black one. Only this thing. This one is flexor deodorum longus tendon. Only this one is the deep component. In the superficial component, there are three things. That is the tibio-navicular ligament. This is in between the anterior border of the or anterior colliculus or anterior border of the medial malleolus with the navicular tuberosity. Here is one tuberosity. So one ligament which is placed anteriorly and superficially in between the anterior border of medial malleolus with the tuberosity of navicular bone. Okay, this is navicular and these three are cuneiform. Okay, in the middle and superficial, this is from the tip of the malleolus, medial malleolus, to the sustentacular tali. And the posteriorly and superficial, this has got the name, that is the calcaneal ligament. Okay, tibio-calcaneal ligament. And this one is the posterior tibio-talar ligament. It starts from the posterior border or posterior colliculus of the medial malleolus to the medial surface of the talus. This is the medial surface of the talus, and this is known as posterior tibio-talar ligament, because there is also anterior tibio-talar ligament, which is the deep component. Deep component of deltoid ligament is in between the intercollicular fossa, that is in between the anterior border or anterior colliculus and posterior border or posterior colliculus. In between these two there is a groove that is known as intercollicular groove of the medial malleolus, and going up to the talus. Okay, but anteriorly. And here also going to the talus but posteriorly. And this is the superficial component, and this is the deep component. This is anterior tibio-talar ligament. Okay. So this is about the deltoid ligament, and about the relation. It is covered by two tendon in yellow color. This is the tibialis posterior muscle, which arises from the tibia as well as the fibula. And here it crosses the in the lower border of the and on the posterior aspect, or you can say the flexor aspect of the ankle. What is the arrangement? That is the doctors are not hunters. The doctor first comes tibialis posterior, then doctor, that is the flexor deuterum longus tendon. Okay, although it arises, that is the tibialis posterior arises lateral to the flexor deuterum longus, but it comes more medially. That's why the mnemonicum, the doctors are not hunters. Okay, here it crosses. This is the crossing point. So, and it insert over the dorsal aspect, plantar aspect of the medial cuneiform and the navicular bone. This yellow color, tibialis posterior tendon. And the another covering is created by this tendon of this muscle, that is the flexor deuterum longus, this one in black color. Flexor deuterum longus, it arises from the posterior aspect of the tibia, and then it forms tendon, which is first cross here, and then second crossing occurs here, and it goes anteriorly and give rise to four tendon, which is going to the medial four toes. And here is the tendon is the flexor hallucis longus to the great toe, and the medial four toes, they are supplied by the this muscle, that is the flexor deuterum longus. Okay, flexor deuterum longus. So it will go like this. This is the flexor aspect, and this is the this is the extensor aspect, and this is the flexor aspect, and this is flexor deuterum longus. So it is going on the plantar side, because above there will be extensor deuterum longus and extensor deuterum brevis, and this is flexor deuterum longus. So it will provide the four tendons to the medial four toes, but on the plantar aspect. And what is the function of the deltoid ligament? As it lies medially, so it helps in the inversion of the foot, as well as the tendon which are covered going to the plantar side, so it helps in the plantar flexion. Or in another way you can say that it prevent eversion of the foot as well as the dorsiflexion. Prevents. And what it does inversion and plantar flexion, and prevent eversion and dorsiflexion. So this is about the deltoid ligament. And one clinical significance is that when there is a tear, it can be very rare, but tear of the deltoid ligament can occur. In first and second degree, we use RICE therapy, that is the rest, ice compression, and elevation. Okay, and in third degree we prescribe surgery. Okay, so this is all about the deltoid ligament. Thank you.